Hi, everybody. I'm very pleased to be here today presenting you research in this international conference and the research that was developed in Brazil and that was developed in the city of Bauru. I am Susana Costa. I'm from the University of Campinas, and this research was developed with Patricia Samarco from the Service of Research and Teaching Health in the Instituto Lauro de Souza, Lima. Today we bring you here the cultural heritage of this hospital that was also a hospital. The museum at Lauro de Souza Lima Institute in Bauru, São Paulo, is a protected heritage that represents the public health struggle of isolation to control leprosy. Today, the institution promotes research, teaching, and health assistance service in Brazil, the second country in the world ranked with a higher number of leprosy patients. The asylum colony was built in 1933 with 400 acres of self-sustaining city, was remote 17 kilometers from the downtown city of Bauru. Showing you our location, we are here in Brazil and in the state of São Paulo, in the southeast of the country. Our city, Bauru, stays in the center, in the middle of the state. It was a railway city, very important, that was connecting the littoral with the interior of these lands in the beginning of the 20th century. Like our asylum, there were more 4 others near from the capital of the state, São Paulo, in 4 different cities, and also another of children, the children of patients. But here in Bauru, we'll bring you the story of this asylum that was hospital and now institute. In 1933, there was already the Cine Casino in a social area and a small church. In 1944, it was built a Catholic church near the casino and incremented this social area. Here, the installations of the patients, non-married patients, women separate from men, and this space, it's with the bigger buildings and collective houses. But there were also family houses, different from poor people, from rich people, like in a city outside of this compulsory isolation. The asylum was called Aimorés. Aimorés is the name of an indigenous community, and in the beginning of the century, lots of indigenous names were appropriate with the government of Brazil to named places like this asylum. We believe that this is a cultural landscape that shows us the evolution of the territory through the time. The crescent cure of the disease originated in the dismantling of the territory since the 60s. The process of heritage safeguard started in the early 90s and focused on this social area that we bring you. This area that was formed by streets, squares, bandstands, churches, sports courts, and caravels that were those bigger houses, collective houses, that were developed by an example of the United States, small houses, and the Cine Casino that is now the museum. It was built to hold cultural and social and leisure events, and now be and tri-dimensional collections in a technical reserve, and also with a long-term exhibition. This heritage and territory has a scientific and cultural importance, like a portrait of a public health policy implemented in Brazil to combat one of the oldest diseases of mankind, leprosy. Helping the historical and cultural research of the region, of institutionalized and socially marginalized citizens, preserving the memory of the impact of leprosy on individuals, also in families and in society, is one of the most important roles of the museum. Medical research, literature, and arts research through the museum contributes, help us to eliminate the stigmatization of the disease that has high cure rates through the advancement of medication and the performance of specialists, such as those who work there at this national and world reference institute. So we start in 2018 there with a monthly exhibition model at the clinic. And also we developed museum visits with patients in the geriatric area. And in 2019, we evaluate the long-term exhibition, Ways of Living at Lauro, Souza, Lima. Working with documentation of the collection, we identify the necessity to reach the staff and patients in the institute. And in 2020, a grant award of Culture and Creative Economy Department of the State of São Paulo implemented the access to public health cultural heritage in the interior of São Paulo region through the exhibition renewal. So the project developed communication that long-term exhibition, itinerant models of outdoor exhibits, audio guide for blind and illiterate people with subtitles and panels new that were developed. The exhibition is still closed because of the pandemic scenario, but we bring you here some photos with the object of the month that was changed all months, of course, and the patients that were in the clinic developed a relation to go to the museum and see the museum. Here, the educational program with the elderly people that live in the geriatric area. We have done visits and the participatory development of research and accessibility research with them. Here the exhibition, the plan to change it, the biggest area has different themes like daily life activities, the church module, the research and attendance module, and leisure moments in the city were themes that we develop. There's also a technical area with the documentation area and other exhibitions. So new subtitles and panels were developed. We innovated the exhibition with digital strategies, with QR code audio guides, and we try to develop the accessibility features. We have this exhibition online. We focused on the history, cross histories, cured histories, and non-told histories. This was the title of the long-term exhibition that is still closed because of the pandemic scenario. So this is a little bit that we bring you here, and we ask you how to ignore this cultural landscape. Well, Bauru is characterized by work and business tourism, scientific tourism combined with academic research in the area of medical science and health. And we have there the botanical garden and the zoo that are neighbors. And we believe that they have a promising relationship due to their proximity with this cultural center. Also, a natural environment is very important there, and we'd like you to show you a little bit of our territory. So I'm very pleased to be here today. I leave you my email for any contact, and we hope you have this trip to Brazil, and that you have enjoyed this trip